Yeah, wait for a second until the presentation comes up.
Oh.
There you are.
Yeah. Great, thank you so much. It's such a pleasure and an honor to be here. Thank you for this chance. And what I wanted to talk about today was how we can scale up solutions. We've heard about a number of solutions today, and what my organization has focused on over the last 10 years is how we can start scaling some of these solutions to reach the poorest 3 billion when we talk about solutions for climate change as well as for health. So my background is actually as a computer scientist. I've been working in the field of developing sensors and analytics for the last 15 years now, focused on reaching the poorest 80 countries. And so I'll start with a little bit of a response to what we've been hearing about over the last 2 days and around behavior change, because behavior change has come up quite a bit. And we've heard about a number of approaches to behavior change, the need for better planning, the need for bottom-up solutions, the need to act local, the need to set a clear destination and work towards it, and the need for measurement, and the need for urgency. And what I would say is that we need all of these things in order to get to behavior change. And it's really going to depend on the context. What I'm going to talk about today is more about what are the systems that are needed in order to get to that behavior change so we can employ a lot of these solutions. And when we think about these systems that we need, we can think about, for example, the Ebola response. So the response to Ebola was one of the more successful sort of convenings of many different moving parts that were needed in order to actually respond to Ebola. And ultimately, it was a system that came together in order to effect a response to a very acute situation. And so what I'll talk about today are sort of more long-term chronic issues that require behavior change, as well as systems in place in order to empower those. So I'll talk first about vaccines. So vaccination, one of the most effective public health interventions out there, but one of the challenges is that vaccines are temperature sensitive. And too often, by the time they're administered to children, the vaccines are actually stored too hot or even too cold. And so by the time they get to kids, they no longer work. And so one of the solutions that we've been developing with the Gates Foundation is a real-time sensor. So this is a sensor, it's a temperature sensor that can be placed into a refrigerator. And a refrigerator like the one you can see in the background there. So this refrigerator works in a clinic in Kenya to store vaccines. And when the refrigerator stops working, this sensor sends out an alert to a healthcare worker saying that the refrigerator is no longer working. But of course, what we found is that this information, this measurement is not nearly enough, of course. This message that goes to the healthcare worker, there's very limited actions that a healthcare worker takes. So in order to actually address the problems that this fridge face, in order to ensure that vaccines reach children, a whole system is needed around this healthcare worker to ensure that she can take the actions she needs to fix the fridge. So a maintenance technician is needed, spare parts are needed, an entire supply chain is needed in order to ensure that she can keep her fridge running. But as we started to prove out that once you put the system in place that you can actually get to real impact, we've started to now scale this solution in a number of countries. So, for example, in India now, working very closely with the Ministry of Health, close to 15,000 health centers now have our sensor device in there protecting the vaccine supply for close to 12 million children a year. So this means that children in almost half the health centers across the country are now receiving vaccines that are much more effective, more likely to be kept safe, because not only is there a sensor in the refrigerator informing nurses when there's a problem, but there's an entire system that's been put in place with maintenance technicians, district immunization officers, everybody now having the same blueprint and the same information in order to respond to these challenges. So what I wanted to talk about today is actually what we've learned in terms of scaling such solutions and how we can start bringing those to climate change. And so the four sort of main factors that we found that were needed, and of course there's a number of things that are needed in order to get to solutions that scale, but here's the four that have really emerged as we worked across India. was the need for affordable technologies, really user-friendly technologies, proper supply chains, and finally, behavior change. So I'll talk a little bit about each of these and in the context of clean cooking, which we've now heard about a number of times today and yesterday. So I won't talk too much about the challenges of clean cooking. We know that there's dramatic, severe health impacts to breathing in the smoke that comes from these cook stoves. These cook stoves also are a major contributor to the residential emissions of black carbon and other pollutants. And so cook stoves can provide a number of benefits if scaled, but as Dan so eloquently put, so far there's been so many sort of one-off projects that have just attempted to scale solutions that do not work. So improved cook stoves, of course, can bring a number of benefits. And so the real challenge is how do we get to solutions that work? And so what we've started with was, let's start with measurement, as has been discussed. So we put a sensor on a cook stove in order to really understand objectively what was working and what's not. So the sensor measures temperature of the stove so we can automatically know when the cook stove is being used and exactly for how long. So the first thing we did was to try to understand what's the value of this information. And so we conducted a study where we looked at when you compare sensor-reported data on cooking with some of the more traditional approaches of asking women, hey, have you used this stove? How have you used the stove? How long have you used it? We compared the sensor report, which is on the x-axis, with the self-report on the y-axis. And what you can see is that there's absolutely no correlation between the two. So what that tells us is that just asking women if they're actually using a stove, if they like it, is not going to necessarily tell us objectively what's going on. And all of us are like that. If you ask me how long I spend cooking or if I like a certain technology, there's many reasons why I'm not going to give you necessarily an objective answer. And so we took this and we said, okay, how do we take more objective information to start to scale solutions? So we developed a model to try to first address the affordability issue. So we've heard a lot today about climate justice, about the need for polluters to pay, and we kind of took that same model and we said, if a coal company gets money from a carbon market to retrofit, why shouldn't women who are switching over to clean stoves, if they're actually using these stoves, shouldn't they also get small payments as well to help them switch over to these more expensive but cleaner technologies? So we built a model where a woman can get a loan from a bank. She gets a stove, she buys a stove that is equipped with a sensor, and that data is sent to a back end, which is then used in order to calculate exactly when she uses the stove, and then a small payment is made to her from a climate fund that is funded from donors in the US. And so this payment is now made to her mobile phone. And so we evaluated this program in 5,000 households. And what we found was actually what everybody's finding. And so this plot shows you usage of the cook stoves. And you see that the usage starts at a reasonable rate in the very beginning, around 2.5 hours a day, and quickly decreases to less than 1 hour a day. And what this shows us is that these cook stoves were not being used after about 9 months. And this is what everybody's finding. The study, I reread the study last night from Malawi, and again, the same result is shown there, that by the end of 1 year, the stoves are actually almost barely used. And so as we start thinking about these types of interventions to get to scale, we can't expect to get to health or some of these other impacts if the technology itself is not user-friendly and is not being used. And I think, Dan really eloquently, as I said, kind of outlined why a lot of these interventions are not working. And so we found that we needed to be able to more objectively go and ask women exactly what was going on with the data in front of us. And we found that when we first would ask a woman, oh, why aren't you using the stove? Again, we got the generic answer. But when we would show her the dashboard, and we would say, oh, you've been using this stove every day for the last 3 months. And as you can see, this is a dashboard showing 5 houses, their usage. And the red is when the women are cooking. And we could go to a household and say, but we noticed that for these 2 weeks, you actually stopped using the stove. What happened? And there was that immediacy where we could go immediately to the woman and ask her, why have you not used the stove? And then we got much more authentic answers. Oh, my aunt came, and then we went here to cook the previous meal, and then by the time I got home, my stove wasn't working. And so we could start putting solutions in place and start objectively and systematically understanding what was going on with these technologies, what was working, what wasn't working, and we could start systematically building a solution that would work. So what we found was that, first of all, the stoves themselves were not very user-friendly, and we found that through this systematic process. So the first thing we did is we started testing every stove on the market, and because we are stove agnostic, we're not attached to any specific stove. So we started trying a number of different stoves, asking women, would you buy this? Okay, if you'll buy it, will you use it? We monitor it, we measure it. We find out exactly which stoves women love, and when they are willing to then just discard their old stove and only switch to these new stoves. So that was the first thing we did, and we tried over 15 stoves with women before we found one stove that they really love. The second thing that we did is we found that when stoves break, traditionally, because, as has been discussed, a lot of the approaches tend to be donor-driven or NGO-focused, there aren't supply chains to actually fix the stoves. Imagine buying a refrigerator for your home, and when it breaks, there's nobody that you can call to fix it. None of us would use this new technology. So the same thing's happening across the world for cook stoves. There's just no locally incentivized supply chains in order to fix these stoves when they break. So we've started training women entrepreneurs, helping them set up jobs, set up shops in order to actually repair these stoves and sell these stoves, so that when the stove breaks, the woman entrepreneur is actually paid for fixing the stove. And so we've scaled way back from the initial 5,000 homes. We've started very small. But what we're finding is that the systematic approach is actually working now. And much like the vaccine program, where we started very small and we started slowly iterating in order to get to something that works, we're finding the same thing in the cook stove program. So the plot on the left is what I showed you before. It was really what every cook stove program that has shared data looks like, with usage declining over time. And the plot on the right is in a small group of homes that finally found a stove that they loved. And you can see that usage is very high, about 4 hours a day for every single home. And that's essentially covering all their cooking activities, and that it's gone for 9 months. And actually this continues, this very high usage. So this is really encouraging, and we're now slowly growing, we're slowly expanding. We're starting to introduce other cook stoves as well so that women have choice. But the main thing that we're starting to do now is be able to look across villages, across districts, in order to be able to say, okay, what's working, what's not, using this objective information. And one of the things that I'll point out here is that getting to adoption of new technologies and getting to scale is really challenging. So this is a plot of only 21 households. The blue dots are when you see cooking on the traditional stove, and the red dots are when you see cooking on the improved stove. And so this is another village where actually there's still some cooking on the traditional stove. And you can see there's quite a bit of variety in sort of cooking behaviors. And so as I started out, I mean, behavior change is ultimately the key to getting to scale, and that we're going to need lots of different solutions for behavior change. But really objectively understanding what's going on, understanding consumer preferences, understanding end user feedback is going to be crucial as we iterate to get to solutions that scale. So I'll end with something that we're evaluating now to better understand behavior change. So we partnered with Intel in order to develop a bangle. And this is a bangle, I apologize I didn't bring it, but this is a bangle that is very beautiful and goes on women's wrists and measures carbon monoxide exposure. And what this bangle does, though, that's more unique is actually it speaks to women in the local language. And it gives them immediate feedback when they are using a traditional stove. And so there's been a number of really interesting things that have emerged from this very small trial with these 10 women in Gujarat. And so, and it echoed a lot of the things that we've been talking about here around behavior change, which is that women love the fact that this is theirs. They love the fact that it tells them something right away when they're doing something. That immediate feedback has been one of the most powerful things of the spangle. But the other thing they love is that it's something that their husband, their kids would never take from them. It's theirs, and that it's unique, it's high tech, and they love that. It makes them feel very powerful. And these are the words that they've used. And so there's something really, I think, important that we're starting to learn now around not only listening to women and their preferences, but also designing technologies that are specifically for them. This is not about taking something that was designed in the US and suggesting that a woman wears it, but really iterating, working with Intel to design this for them. So it's been a really kind of interesting and provocative sort of exploration that we've done with women. I think the final thing that I'll say about this is that it's been really crucial that we respond really quickly to women's feedback. So, for example, when a woman tells us that a cook stove's not working and the entrepreneur is not fixing it, we respond right away. And that rapid feedback we found has been really crucial, that we are rapid in our feedback to women's to women's responses as well. So as we think about putting these systems in place that can scale solutions, I'd really urge all of us to think about having not only data and measurement, but really systems that can respond to what that data is telling us, and empowering all the individuals to be able to take actions in order to respond as well. Thank you.